Diabetes, does it really run in the family? Hi, I'm Dr. Kim Kuebler. I'm an award-winning author of 8 textbooks and multiple peer-reviewed published papers. I'm considered a national and international thought leader in chronic conditions, palliative care, and pain. I'm a clinician spanning 37 years, a researcher, an educator, a health policy expert, but most importantly, I'm a patient advocate. Did you know that there are 3 types of diabetes? I'm going to discuss the differences between type 1 and type 2 diabetes. Gestational diabetes occurs during pregnancy, and there is significant data to suggest that pregnant mothers who develop gestational diabetes during their pregnancy may go on to develop type 2 diabetes as they age. Type 1 diabetes occurs when the immune system attacks and destroys the insulin-producing beta cells of the pancreas. Type 1 diabetes is considered genetic and does run in families. It's usually diagnosed at a younger age, although environmental factors such as viruses can also contribute to the immune reaction of the beta cells within the pancreas. Type 2 diabetes, on the other hand, occurs as a result of lifestyle. Being physically inactive, being overweight or obese, can contribute to type 2 diabetes. Extra weight, particularly belly fat, is linked to insulin resistance. Type 2 diabetes also affects the heart and the blood vessels within the body. Currently, more than 34 million Americans have diabetes, and that's about 1 in 10 people. And of those 34 million, approximately 90 to 95% have type 2 diabetes, so you can see that it is predominantly the primary type of diabetes in the United States. Type 2 diabetes most often develops in people over the age of 45, but we are now seeing more children, teens, and younger adults developing type 2 diabetes as a result of physical inactivity and obesity. Symptoms that are common to diabetes I will discuss, but it's important to understand that type 2 diabetes occurs slowly over time, whereas type 1 diabetes is a sudden onset. Patients who don't know that they have diabetes may often experience increased thirst, frequent urination, frequent urinary tract infections, blurred vision, tingling and numbness in their hands and feet, or sores that do not heal. Oftentimes, people will lose weight before they're diagnosed with having type 2 diabetes. Blood tests are used to confirm a diagnosis of type 2 diabetes. The hemoglobin A1C, which is considered the gold standard of determining whether someone has type 2 diabetes, measures an average blood sugar over the past 2 to 3 months. An A1C below 5.7 is considered normal. Between 5.7 and 6.4% indicates prediabetes, and 6.5% or higher confirms type 2 diabetes. Fasting blood glucose or sugar test measures blood sugar after an overnight fast of not eating. A fasting blood sugar level of 99 or lower is considered normal. 100 to 125 indicates prediabetes, and anything over 126 confirms type 2 diabetes. 1 in 4 Americans have type 2 diabetes and they're unaware. There's a really nice risk factor test that you can take from the National Institutes of Health to determine if you might have type 2 diabetes, and I've provided the link here. The longer you live with diabetes, the more problems for the heart, the eyes, the kidneys, and the feet. And diabetes can be prevented and oftentimes even reversed. You can learn more from the National Institutes of Health on prevention and ensuring proper management of diabetes. It requires a lifestyle change. Good nutrition and physical activity are important parts of a healthy lifestyle. balancing what you eat and drink with physical activity, and taking your medications appropriately if prescribed. What you choose to eat, how much you eat, and when you eat are all important in keeping your blood glucose level in the range that your healthcare team recommends for your plan of care. You can learn more at Multiple Chronic Conditions Resource Center.